Hello and welcome. Thank you for joining us for today's webinar, Measuring Food and Nutrition Security for Urban Consumers in Times of the COVID-19 Crisis. A few housekeeping notes before we get started today. Microphones are muted during the presentations. Please feel free to use the chat box at the bottom of your screen to communicate with other participants or to contact me for logistical support. Please share questions for our speakers using the Q&A feature, and if possible, indicate which speaker you're directing your question to. We will answer as many questions as possible during the live Q&A, and we will share answers to all of the questions, as well as copies of the presentations in the community's event page and the week after the webinar. A recording of the webinar is also going to be immediately available on the Data for Nutrition YouTube channel. If you are experiencing any technical difficulties, please feel free to communicate with me using the chat by selecting all panelists. I will do my best to assist you. Today's webinar is hosted by the Data for Nutrition Community of Practice. Data for Nutrition provides members with opportunities to share knowledge, experience, and questions relevant to strengthening the nutrition data value chain at all levels for the purpose of achieving better nutritional outcomes in low and middle income countries. We are proud to say that our community has 760 members and we're still growing. My name is Riley Auer. I'm the communications coordinator for the Data for Nutrition Community of Practice, and I work with the Johns Hopkins Bloomberg School of Public Health. I will serve as today's moderator. Today's speakers are Dr. Christine Chege of the Alliance of Bioversity International and the International Center for Tropical Agriculture, or CIAT, and her colleague, Dr. Alan de Brauw of the International Food Policy Research Institute. Dr. Chege's research focuses broadly on consumer behavior, understanding and intervening in the food environment to improve nutrition among consumers, nutrition-sensitive market systems, food and nutrition security, inclusive business models, and private sector engagement. Her colleague, Dr. de Braaw's research also focuses broadly on understanding the impacts of agricultural interventions and evaluations to understand constraints along value chains. During today's presentations, Dr. Chege and Dr. de Brauw will share insights from Hungry Cities Project implemented in Nairobi, Kenya, and a study conducted by IFPRI in Addis Ababa, Ethiopia. Without further ado, I'll turn it over to Dr. Chege. Christine, over to you.
Thank you very much, Riley. I'll share my screen right away. I hope you can see my screen well. So I'm very happy to be here today to present some results of one of our research findings, one of the research that we've been conducting in Nairobi, Kenya, and with the urban low and mid-low income consumers. So consumers in the slums of Nairobi and those in the non-slum locations. So just to give a quick overview of where all this is mapping on, first of all, we understand the current growing population, especially in the urban areas, broadly in Africa, but also in other regions, especially in the low-income countries. And with the growing population in the urban areas, we know that there is also going to be increase in demand for food. And this is not just food that is important for filling our stomachs, but also food that is going to nourish the population. So this right away puts on spot the importance of urban food and nutrition security, even before talking about the pandemic that we are experiencing at present. And when we talk about the food and nutrition security, again, this becomes a serious or rather an interesting topic and a topic that we all want to address, because the situation at present is that just from the recent report that was released by the FAO in July on status of food and nutrition security globally, they reported that at present 690 million people globally go hungry every day. And they actually also saying that in the current situation of the pandemic, we expect even more these numbers to increase in 2020, given the pandemic that we are experiencing. Then when we also think about the nutrition situation, micronutrient deficiencies still remain a challenge. Overnutrition also remains a challenge. Almost 2 billion people are still suffering from overweight, and over 600 million of these people are obese. So the question again is, as we think about the pandemic, how does this nutrition and food security situation look like? And how have people shifted their consumption behavior or changed their consumption behavior in the picture of the current pandemic? So the results I'm going to present today are mapped on a bigger project called Hungry Cities, Inclusive Food Markets in Africa. And this is a project we are implementing in Kenya with a partner who is a private food distributing company called Twiga Foods. The project is implemented in Kenya, specifically in Nairobi. And the main goal of this project is to understand and also to try and improve the consumption of fresh fruits and vegetables, specifically by the urban poor. Several goals or objectives that we are looking at is, first of all, understanding the consumption behavior, what drives food choices for consumers in the slums and in the non-slum locations, and broadly, how does the food environment which role does it play in terms of changing the consumption behavior of this population? And then finally, looking at the effect of the COVID-19 on urban population and food environment. And this last objective is what I'm going to present today. Some research questions that we are answering on through the COVID research. First of all, we want to understand how has the current pandemic affected the food security, diet and consumption of fresh fruits and vegetables by urban poor in Nairobi, but also not only focusing on fresh fruits, we also want to understand how the other foods consumption of the other foods have changed. And then once we understand the changes that have happened, the next question is, do these changes look different between the slum, or rather the low-income consumers and the middle-income consumers? So how are these two different categories of consumers affected by the pandemic? And finally, what some of the policy implications we can pull from that, and what could even the developmental agencies work on to address these COVID effects? So we've done so far 2 rounds of primary data collection, and we are doing the surveys in 2 slums of Nairobi, that is Kibera and Mathare, and then we are also talking to households in 4 middle-income locations. These are the non-slum locations. The 2 studies we conducted, the first round of data collection was done between April and May. This was the period when the country was under lockdown. So markets were closed. There was no movement into or out of Nairobi city. And there was quite some stringent restrictions in terms of movement of funds as well. And then the second round of study was conducted in October, so just a month ago. And this period, we refer to it as the post-lockdown period. So these are the 2 rounds of data set we have. And in total, for the 2 rounds, we've talked to around 2,400 consumers or other households in both rounds. So just to give some insights on what kind of information or data we captured. So the first question we asked ourselves was how do we capture this information that we're interested in a rapid way? And also considering that this research was done through phone interviews. So for us to be able to understand what's happening to consumers in terms of food security, in terms of their consumption behavior, in terms of diet quality, what kind of indicators can we use? So considering all these, especially the rapid approach that we are using, we thought that household dietary diversity was a good indicator, and we selected that as an indicator for diet quality. And we used the 7-day recall period for the household dietary diversity, and specifically we used the household dietary diversity that uses 9 food groups. And then in terms of food security, we also asked again, what kind of questions can we ask on that to capture the food security? So we borrowed questions from the Household Food Insecurity Access Scale. And these are the questions, we have standard questions on that scale that capture what kind of food consumption that households are consuming and the coping mechanisms and all that. So we also borrowed questions from that tool. And then also, in addition to that, we also had questions to reflect on the kind of, like to give us information on what kind of consumption behavior these households are how they are changing their consumption behavior pre-COVID and post-COVID or during the COVID period. And we had both qualitative and quantitative questions to capture that. For example, what kind of food they're consuming now, what they were consuming before, how that has changed in terms of even the prices, in terms of point of purchase and all that. Now, coming to the results. Yeah, sure. I don't know if you can see my title. It's a bit hidden by that bar, but it's these are questions that we asked to capture the food security situation for the households during the first round of survey. That was the April-May 2020. And some of the questions we asked, we wanted to see how the households are affected in terms of the kind of foods they're consuming, the meals in terms of the number of meals in a day, the portions of foods they are eating in a day. Are they looking at, are they consuming less preferred foods? Are they consuming the varieties? Is the variety changing, the variety of foods they're consuming? So in this graph, we compare, we show our results differentiated between the slum households and the non-slum households, and the green bars are the slum households. And then the orange bars are the non-slum households. So what we see conspicuously here is that the slum households, the bars for the slum households are all through, they are higher or they are larger than the non-slum households. And just to take you through, like for example, in the first case, we see almost 90% of the slum households indicating that they were eating fewer meals in a day because there was not enough food to eat. And then they were also eating smaller meals than they felt they needed. Again, 90% compared to 43% for the non-slum households. They were eating a limited variety of food due to lack of resources to purchase food during that period. And also they ate less preferred food, again, 91%. So all through we see like the food security situation for all the households were compromised, but mostly for the slum households. Then also in following up on that question in the last survey that we did in October, we also asked how their consumption has changed now compared to a month ago, like what they were consuming in October compared to the previous month. Are there changes? So still, even in October, we see the variety of food consumed is still, a number of households are reporting a decrease in the varieties of food that they're consuming. And the second component that also was highly reported was the decrease in quantities consumed. So we see there may be some positive change, but still we see there is an effect still on what households are consuming in terms of the varieties and in terms of the quantities. Then here I show a table again, which we captured in the first round, trying to understand specifically for fresh fruits and vegetables. And we asked them over the past 4 weeks, how has your quantity of fresh fruits and vegetable consumption changed? So here they were reporting whether their consumption of fresh fruits and vegetables has increased or decreased, or there is no change. And what we see here highlighted in red is that for the slum households, the households that are in the slums, 92% of them reported that their quantity of fresh fruits and vegetables that they're consuming has actually reduced. Whereas, and for the non-slum is 55%. But then we see again here, 43% of the non-slum households said that they did not have much change. So there is not much change for the non-slum households, but then half of those that had a change, actually they reduce their consumption of fresh fruits and vegetables. And then the second one, when we ask what was the reason, now for these ones who reported a change, a reduction in the quantity of fresh fruits and vegetables they were eating, we asked them why did they reduce? What led to that decrease in the consumption of fresh fruits and vegetables? And again, we see different reasons for slum and non-slum households. For the slum households, their main reason as to why they reduced their consumption of fresh fruits and vegetables was because their incomes had reduced. And again, in a different question, which explains this reason, is where many of the slum households indicated that they lost their jobs. Most of them were in formal sector, and now they didn't have, they were not going to work, meaning that their overall household income had decreased. Therefore, this affected the consumption or other purchase of these fresh fruits and vegetables. For the non-slum household, you see most of them, there's a percentage that also mentioned the reduction in income, but the biggest percent was more on the side of the fresh fruits becoming more expensive. So they might be having some cash, yes, but the fresh fruits have become expensive, so they have decreased their consumption. Interesting, when we did the first round of study, we realized that through discussing with the respondent that some people had changed behavior, yes, in terms of what they were consuming, but also there are some foods which are being avoided. So in the latest round of data collection in October, we wanted to understand, are consumers avoiding certain types of foods because of COVID, of course, which may again mean that the nutrition or food security of the consumers might be affected in one way or the other. And interesting here, what we find is that like 47% of the respondents mentioned that actually they avoided animal source foods. And there's a bigger percentage for the slum households. So they're avoiding animal source foods because of COVID, because they feel it's associated with COVID. And then 42% are avoiding restaurant cooked foods, again, because they feel it might be associated with COVID. And this percentage now for the restaurant foods is even higher for the non-slum households, 59%. Then now we went into analyzing the dietary diversity, the household dietary diversity scores. And here we are comparing the diversity scores for the first round and the second round. And we have the 9 categories that I mentioned here. So the first comparison here is for the 2 rounds, an overall comparison. And what we see here is that if you look at the first entry and the second entry in that highlighted box, is that there is some slight positive change. Like there's a bigger percentage of households that are consuming different types of foods in general. Then we were also interested to understand, do these differences differ? Are there different significant, I mean, are the differences there between slum and non-slum households, and also between households that are headed by male and female? So in the next 2 bars, we did the analysis differentiating between male and female-handed households. And the one I've highlighted there is a male-handed household. If we compare that with the yellow box, we see the female-handed households, there's lesser percentage of households that are consuming different types of different food groups compared to the yellow box, which is the male-handed households. So again, we see some gender differences. Depending on who is the hand of the household, it may mean they have access to different resources, and therefore they might be affected differently by the pandemic. And the same difference we find when we differentiate between slum and non-slum households. We find a lesser percent of households consuming the different types of food groups in the slum category compared to the non-slum category. Again, depending on the socioeconomic status of the household, then they might have been affected differently by the pandemic. Finally, here, this one is now using the household dietary diversity index. So this is now the index. And again, we compare the yellow bars, the purple bars, which are the results of the October study, and the blue bars, which are the results of the April-May study. If we look all through, we see that there is a consistent increase between the blue and the purple bar, which shows some level of, like, the household dietary diversity has slightly increased between the first round and the second round of data collection. So again, this could be an indication of some recovery over time between April and now. So this year we have to understand more on that. Just moving on to the last slide. In this slide, we're trying to capture what are the socioeconomic impact of the pandemic on the household. And some results that come conspicuously here is the effect that the household felt in terms of the change or the increase in food, the cost of food and other commodities. So most of the household mentioned that there was a high cost of food and other commodities during the pandemic period. And then also a few households, like a third of them, mentioned about shortage in food supply. And finally, there was a number of the respondents that mentioned a change in their employment income. some have lost their jobs permanently, others temporarily, but also some have lost their income that comes from business. So what we get from this study finally is that, of course, we find that the diet and livelihood of majority of the urban households has been affected broadly, but then the effect is different depending on the socioeconomic status of the household. And here we use the slum and non-slum as the proxies. And then also depending on the household head of the specific households. So the question then is, how can we, as we continue intervening in this environment, what are some of the policy interventions that can be put in place to make sure that the gender sensitivity is considered and also the socioeconomic differences of these households are considered? Here, I'm sharing a number of outputs that we have from that work for future reference in case anyone is referencing that. Thank you very much. Thank you, Raylai. Over to you.
Thank you so much, Christine. Alan, over to you.
Thanks, Riley and Christine. I'm going to figure out how to share my screen here and go to the first slide. And I want to thank you all for listening. I'm going to do the beginning. Okay, perfect. I'm going to talk about food consumption and food security during the COVID-19 pandemic in Addis Ababa. This is joint work with my colleagues Kala Hervonen and Kasha Abate. And we, again, thank you for listening. So just to give you a little bit of background on how the, to start with, on how the crisis has manifested itself, the pandemic has manifested itself in Ethiopia. Ethiopia has largely managed to keep the COVID-19 infection rates relatively low for a reasonably well-connected country. It had a rapid government response after 3 days after the first confirmed case, including social distancing measures right away. Schools were closed, they banned large gatherings. There was awareness creation on preventative measures such as hand washing, social distancing, and wearing face masks. They immediately declared a state of emergency, trying to prevent layoffs and eviction of tenants. And there was a social protection response reasonably soon thereafter as well, which included new food banks and expanding the urban protective safety net program, which is an existing social protection program in Ethiopia. The country, though, never went into a full lockdown that severely restricted moving. And the number of cases has been kind of steadily increasing over time. I don't have an updated number here, but as of October 25, there'd been 93,000 cases, positive cases, and about 1,500 deaths, and that's over 100,000 now. Most cases have been in the capital rather than in rural areas in Addis Ababa. We quickly took advantage of a set of phone surveys that we had done for a randomized control trial that took place in a representative sample of households in Addis Ababa. We had done a baseline survey in September of 2019 and then a second survey in February 2020. And we decided to do a rapid set of phone surveys taking place in May, June, July, and then a final round in August of 2020. We conducted the phone survey with 600 of the roughly 900 households in our overall sample. We had very low attrition rates, and we focused our measures on food knowledge and behavioral response, stress levels, income changes, and food and nutrition security measures as well. We actually decided in August of 2020 to use a comprehensive food consumption module. You'll see why in a little bit, which we had administered in September 2019, in February 2020, and then we did it again in August over the phone. So the two in person were in September and February, and the one in August was over the phone, which we did some substantial testing before we did. And by a comprehensive food consumption module, I mean, we asked about the consumption of about 100 different goods. Maybe we have that number exactly in there, one by one to get a detailed 7-day recall. So starting in right away with results, we first asked about knowledge and behavioral responses to COVID-19. This is broken up by quintile, so the colors going down go from richest to poorest. Again, we have roughly a representative sample of Addis. So you can think of this as the richest quintile, the next richest, the middle, the near poor, and then the poorest quintile going down, and then the dark blue is an average. So we see that a lot of people knew a lot of the things they should do. This is in early May. They were already keeping distance from people. They were staying at home. They were washing their hands more frequently or for 20 seconds. They were many people were avoiding large gatherings or public transportation, avoiding contact and trying to use hand sanitizers. Fewer people were using face masks or wearing disposable gloves, but that probably has to do with availability more than anything. In all three of the rounds in which we asked, people suggested they were extremely stressed out. We asked just the question on a 0 to 10 scale, how stressed are you? So 0 would be not stressed at all, and that's all the way in the lightest red, and the darkest red is extremely stressed. So we have people suggesting, people were answering 10 on this scale about 35% of the time in May, goes up to even 45% of the time in June, and about 40% in July, and stress levels were just at least 5 for most people. So we did see that there are substantial increases in stress. And a lot of people were also reporting losses in income. So this is a question where we're just asking, how much did your income change? Not at all. It's gone up a little bit, much more, somewhat more. But these are the answers we're showing you. Here are much less or somewhat less. So these aren't anchored to anything. And in all three of the surveys, you can see that by quintile, people are suggesting their incomes have, at least 60% or 70% of people are suggesting that their incomes have declined relative to usual. The people on the richer end are less likely to report that they have less income than people who are middle to poorest quintiles. And we also see a lot of people reporting involuntary job losses, particularly at the beginning of the pandemic. Many people left their jobs voluntarily in May, and they had kind of returned to working by July. And there are some involuntary job losses going on as well. Likely reflects a lot of the fact that the labor force is fairly informal in Addis Ababa. Okay, so we also ask a household dietary diversity score. Here we're going to group food consumption into 12 food groups rather than just the 9 that Christine used. The score ranges between 1 and 12 with higher values indicating better food and nutrition security. And we're going to compare this for you to the PS&P areas, which are poor areas in rural Ethiopia from a survey that IFPRI has also been conducting. So if you look at our household dietary diversity scores, they did drop. In September and February, the averages are 9.2 or 9.3. These dropped to 8.5, 8.5 and 8.1 in May, June, and July. And then they go back up to 9.4 in August. Now, there are 2 things that I want to mention about this figure before moving on, or 3 actually. One is that we're computing these slightly differently. So we're building them off of these detailed recalls in September, February, and August. So it's a little bit of a different methodology than just broadly asking about the categories of consumption as we did in May, June, and July. And that recall difference may be important in determining why the September, February, and August are higher than the May, June, and July. Second thing is the July survey coincided with an Orthodox fasting season, so people are avoiding specifically animal source foods in July, so that's one reason that shifts downward. And a third thing to note is that in Addis Ababa, dietary diversity is much higher than in the PSNP areas, where it's averaging about 4.3 in July of 2018. They're consuming much more, substantially more food groups in Addis Ababa than in those poor PSNP areas. Okay. Just to note again, so this compares September 2019. Let's go back. In September 2019, we have a 9.2 average, and in August, 9.4. So now we look at those by the household wealth index, which is measured in September of 2019. We can see that regardless of the wealth index, we don't see the dietary diversity in this broad way being affected at all. And again, this is even at the very poorest end in Addis Ababa, we see that the household dietary diversity is well above that in the PSNP areas. We next want to look at the difference in household. We want to look at the difference in household per capita consumption in September and August of 2020. And let's focus on the figure on the left. It might be easier to look to focus on. This is a kernel density of the probability distribution function. So essentially, what we're seeing is that the distribution of the logarithm of per capita consumption, this is the value of per capita consumption in Bur, is roughly the same in September 2019 and in August of 2020. So whatever the COVID-related shock has been, it is not affecting the overall value of household consumption in the sample. The right, for those of you who like cumulative density functions rather than probability density functions, shows this roughly the same thing, that at no wealth level is there a real difference. We don't see a shift. If we had seen a negative shift, we would see that red curve to the left of the blue curve, and we actually see it to the right for some of the poorer households. And this is the same curve essentially in calories, and in fact we here see that calories may have increased, caloric consumption may have increased by August 2020 relative to September 2019. Now, not all calories are the same from a nutritional perspective, and although we see a similar consumption pattern at the food group level, as we show here between September of 2019 and August 2020, for fruits, meats, vegetables, eggs, and dairy, actually we see some differences in the quantity composition of consumption. So these tables table 1 here looks at the mean per capita consumption in butter by food group, and it's in calories in the bottom. So let's look at the bottom one just because we have nutrition audience. If we look at calories, we see that calories consumed of staples goes way up by 23%, whereas we see calories of legumes, nuts, and vegetables dropping by 19% and 26%. So there's a big shift away from eating relatively nutrient-dense foods, those nutrient-dense foods, to staples. And we see then, that said, we see some increases in fruit and dairy consumption, although those, you can see the calories being consumed are pretty low in those areas. And we see a decrease in all other foods. That's actually being driven by a decrease in palm oil consumption, because palm oil imports from Indonesia were actually restricted, and therefore prices were going up. We did look at heterogeneity as well, and we in a disaggregated analysis, and we should see no or very minimal differences in the composition of consumption between households that either avoid uncooked vegetables versus those that didn't, among households that had income losses versus no income losses, and then job losses versus no job losses. So to summarize or conclude, we see that there's a high awareness in Addis Ababa and adherence to recommended practices to avoid COVID. There's very high stress levels concentrated among the relatively poor. Despite reported reductions in income, there's really little change in the value of consumption, caloric content, or broad dietary diversity from September to August. which is suggestive that the initial shock in Addis Ababa was largely temporary, and households have been able to cope relatively well despite the stress. And we would like to do more research on whether the PSNP may have helped. We need better measurement of the magnitude of income loss in food surveys, and because we think that much less and somewhat less is clearly not adequate. And we think that this evidence shows that many agricultural value chains have actually been resilient to the pandemic, since this is a population of households that are all buying all their food. Thank you very much.
Thank you so much to you both for your excellent presentations. It's so interesting to hear how things are going on and how you are going about measuring. So if everyone can please use the Q&A feature to share questions with our speakers and indicate who you're directing your question to, that would be great. We'll get started with the Q&A session. So just a first question for you, Christine. You shared some implications from your study, but it would be great to know how the results will be used by development agencies, donors, or other food systems actors to improve diets and food securities of consumers, especially in the slum areas.
Thank you, Riley, for that question. So from our analysis, what we are finding, first of all, the differences in terms of the effect that we are finding for the slum households and the non-slum households, the gender, although we are still doing some more in-depth analysis, especially in gender disaggregated, to see how these effects are actually affecting different households. But then what we already get here are some quick results, early results in terms of telling us actually the effect might be different for the different socioeconomic status, depending on the different socioeconomic status of the household. Like the slum households may be affected differently from the slightly well-off households. So these I think are some of the results that can be picked up by either the policymakers or the even development agencies as we think of how we can intervene to calm down the effect of the pandemic. Then we definitely need to keep this in mind, that one policy that cuts across all households may not apply or may not favor the low-income households, for instance. And again, thinking of the gender perspective, are we putting in place some policies or some interventions that are also gender sensitive, that are looking at how the male and female-handed households are being affected by the pandemic? Thank you. And also, just to hand a bit more on that, is also again the private sector. So when we did the first analysis in April, we were able to share our results widely with the private sector companies that are working in the food sector in Nairobi, and also with the policymakers. And some of the private sector companies actually picked up those results, and they were able to intervene in the slums. Some actually lowered their prices for foods in the slum areas to make the food accessible to these slum consumers. So this is again another direction where even the private sector or other actors in the food system working in that space can see how to use the results and intervene. Thank you.
Wow, thank you so much, Christine. I just want to direct everyone to the Q&A panel. Ateka Owais had asked for some references with regard to Alan's work, and Alan has shared a brief link to the paper there. So direct your attention. Alan, perhaps a question for you. In the fourth round of your data collection, you had collected a 7-day recall for food consumption. Under what conditions would you recommend trying to collect a 7-day recall for food consumption using a phone survey?
Yeah, thanks. So we thought carefully. That was one of the bigger. It was kind of a big risk we thought we were taking by collecting this larger food consumption survey. We'd been really pushing to make sure our surveys were only 15, 20 minutes long, and not really stressing the households too much with the phone surveys, because we understand that the information can get really poor if you ask too long of a phone survey. But we had effectively found that between May and July, there hadn't been very many changes in the way people were answering questions. And we were worried instead that our August survey would be essentially boring, not telling us not providing us with enough new information to keep, to do it again. So we also had built up a lot of rapport with the households between the 5 surveys that we'd done between September 2019 and July. And we had been providing the households with phone credit for participating in our phone survey. And it seems like we'd hit a good number because we'd also been initially worried about participation in the phone survey, and we had really no problems getting people to participate at that point. So one condition, I think, is that you have that rapport, because we were then able to kind of push that that relationship and do a little bit of a longer phone survey. Then we actually did do quite a bit of pre-testing of the questionnaire before putting it in the field. And what we found from that pre-testing was that we had problems, but they were different problems than we have when we do a food consumption survey with 100 or so items in person, but they were no more complicated than those problems. So we felt like once we knew that, we were in good shape to go ahead and try it. And we don't see, we've now actually also done tests on whether statistical tests on whether the data are of differential quality, and they seem to be of the same relative quality as the in-person survey. So we were pretty pleased with that.
Wonderful, thank you so much. Another follow-up question from Ateka Owais. They were asking, were you also able to assess whether there were any differences in gender and age, particularly among children, women, and adolescents?
Yeah, that's a great question. No, is the answer. We're getting one person on the phone, so we're not really getting at whether there are differences in age or gender, and that's a real gap when you're doing phone surveys relative to doing surveys in person. The nuance of questions that you can ask is just a little bit lower. Some of our colleagues at IFPRI have done phone surveys in which they realized when they were asking women, when they would specifically ask women questions, they were often told to put the phone on speaker by their husbands. So they were being listened to, and they kind of were trying to record whether there were different answers given when women were on the phone than men. I'd have to check, but I think a lot of our food consumption may have actually been answered by women. So because they would know more about it, but we asked initially to talk to the household member who'd know more about what was purchased and what was consumed within the household. And then a follow-up on male or female-led households that I see there is that female-led households, I have to check, but we have a smaller proportion, of course, of female-led households than male-led households, and I'm quite sure we did heterogeneity analysis on that, and we didn't find any differences.
Thank you so much. For Christine, do you plan to conduct further follow-up studies to the work that you shared to understand the effects of the pandemic, perhaps a year later or another period of time?
Yes, thank you, Riley. Yeah, the plan we have is, so the first round we did was during the lockdown period. Of course, like I mentioned that time, there was a number of restrictions by the government in terms of movement, but also in terms of access to food. Like, for example, the markets were closed. So when we did the second round of data collection in August, all these restrictions were not there. And the idea now is to do another round of study next year, around February, hoping by that time things will have stabilized. Currently in Kenya, we are experiencing the second wave of the pandemic, but things are they look a bit settled here and there, so we don't know how the situation will look like by January. But we are hoping by January, February, if things start stabilizing again, then that might be a good time to do another round of study to see how is the consumption behavior and diets and food security of these people changing again, given the change in the COVID situation. So yes, we plan to do that early next year, hoping the COVID situation again will have changed and we can be able to capture some effect and see how that is affecting the population, both in the slum and the non-slum locations. Thank you.
Wonderful, thank you so much. And another question for you, Alan. How do you reconcile the results on stress with the results on food security?
That's a great question. I think what we're seeing is that one way to do it would be to imagine that people are having a harder time obtaining the food or just living their daily lives than they are. That they're having a harder time obtaining food and living their daily lives, and that's what's causing stress, along with the pandemic. And I mean, your kids are presumably, I'm not sure where they are with schools, but your kids are home, and those things are all causing stress. However, it does seem like the food system has recovered, at least in Addis Ababa, in some way. And again, like we've done some complementary value chain studies, and we know, for example, about the palm oil issue. On another note, onions, for example, have become much cheaper because a lot of onions that are grown in the West typically go to Sudan, and they haven't been going to Sudan because of border restrictions. So instead, they're flooding the market in Addis Ababa. So I think what we would, so my sense is that it could be that people are having a harder time finding things. It could be that people are just having a hard time with the social distancing, but it does seem like they're not having as much of a problem in overall in obtaining enough food. Now, the right types of food is a different question, and I think we'd like to know a bit more about that and how it's continuing to evolve.
Thank you. Okay, well, perhaps while the audience continues to add questions to the Q&A box, perhaps either of you could maybe speak to why you chose the metrics that you chose for the context that you were looking at. Christine, would you like to lead off?
Yes, thank you. That's a good question. So I mentioned briefly in my presentation, and again, even Alan has mentioned a bit on that as well. When conducting the phone surveys, the phone interviews, one thing is really being careful and asking yourself, which would be a good metrics to use, and the right indicators to use. At the same time, being conscious not to overwhelm the respondent. And of course, pre-testing those tools very well before you do the study. So that was one of the questions for us that we considered. And because we said we want to talk to 2,000 respondents, we are talking to people in the slums, to people in other areas. Some of these, and it's urban consumers, they may not be having a lot of time to respond. So which would be a good metrics to capture these questions that we're interested in. So through that discussion and trying to check the different metrics, then we thought household dietary diversity for the diet quality would be a good one. Initially, we thought actually to also have some indicators for children and women. But then when we looked at all those indicators and the length of the questionnaire, we thought, okay, it may be too optimistic. And eventually we may lose the quality of data if you're asking, if you're using too many metrics or you're trying to capture too many things, especially over the phone. So because of that, then we settled on the household dietary diversity for the diet quality. And then again, looking at the same questions and asking ourselves how to capture the food security questions and the food security situation, we thought about that using the same kind of thinking of quick questions to capture the food security and not having the respondents too long on the phone, just to make sure we don't compromise the quality. Yeah, then we selected the questions that I was highlighting on the household food security access questions. Yeah, and then on top of that, we also added a few of qualitative and quantitative questions just to follow up on some of the responses that we are getting regarding the consumption for both diet and also for food security. Thank you.
And thanks, Christine. On our end, we thought basically we tried to get down to as short a survey as we could humanly possibly get to in May, asking about the types of things that we thought were going to be important. And so coming up, measuring a dietary diversity score we thought was kind of crucial. To be honest, we also we talked to a lot of people as we were doing this. We talked to the WFP, who do a ton of phone surveys. We talked to other people at IFPRI, because IFPRI started doing a number of phone surveys around that time as well. And we talked to other economists. There's a great website called Recover that IPA put together. Recover doesn't have an E in it. And a lot of people shared the surveys they were planning to put into the field and what they were doing. And so we basically, and we share, I think we shared our survey that way. So we kind of did everything quite collaboratively, trying to learn about what other people were doing, and kind of fitting our survey into a niche there.
Excellent. Thank you so much. As we start to get towards the end of our time, I'm just wondering, do either of you have any thoughts that you'd like to share, any key insights as you move forward? And Christine, you had already mentioned that you are planning another round, but just any parting thoughts?
Sure, I'll go ahead. So from our side, or from my side, I think what we've learned this year is that phone surveys are a plausible way of getting some information, and pretty cheaply as well. And it's going to be interesting to see how much we, as the pandemic ends, hopefully in the next year or so, I think this will change the way we work a little bit, in terms of possibly trying to work more of these types of surveys into the type of work we're doing, more than just monitoring. I think we can use them to well, maybe as an important monitoring tool that can get us intermediate results and learn quickly about what could or could not be going wrong in the types of things that we're doing, to measure food security and outcomes from trials or what have you that we're involved in.
And just quickly to jump in addition to that also, and yes, Alan, I also agree. When we did our phone interviews, actually we sat down and we were comparing doing a face-to-face interview and how much it would cost. Actually, it's a big saving. So I believe moving forward, this actually may change how things are done and how we do research. Yeah. But from my side, in terms of some parting shot, one of the things that has remained a bit unanswered, even with the study we've done to understand the situation and how the pandemic has affected the urban areas, is really how does this connect backwards like looking along the value chain, because now we find effect in the urban areas for the urban consumers, and most of these are almost over 95% are food purchasers. So when you talk of the fresh fruits and vegetables, they're actually relying on markets. And that's one of the reasons why we found, I think, in the first round of survey in April, May, there was a big effect because they were relying on the markets, and a number of those markets were shut down. They didn't have flow of food to the markets. But then looking backwards, even with the pandemic and even at the end of the pandemic, how well connected are these food system actors? If it's the food distributors in the slums, where are they sourcing their foods from, and how is that leading to a strong or a weak food system in terms of the supply of those commodities to those urban areas? So I think also that's an eye-opener in that space, and an area that we could also look at and say how to strengthen our food systems in future to make them more resilient, especially in cases of such pandemics. Thank you.
Thank you both so much. The comments on cost and resilience are really pertinent, especially now as we're entering the year of action on nutrition. Well, thank you all so much for joining today's webinar. A special thank you again to Christine and Alan for your insightful presentations. We hope you enjoyed the presentation today. A copy of the webinar is available on the Data for Nutrition YouTube channel, and copies of the slide decks as well as a summary of the Q&A will be available within the community of practice in the coming weeks. Thank you again and have a wonderful day.